Hello, my name is Zachary. I'm a physician assistant at Fairbanks Urology, and with me is Chad. We would like to talk to you about an important subject, testosterone. So Chad has a couple of questions that you may have about testosterone. So let's begin.
I was just wondering, what is testosterone and why is it important for men?
So that's a great question. Testosterone is the male hormone. It is in charge of basically everything that separates you from the opposite sex. So it controls your increased muscle mass. It improves the hair on your chest. It gives you deeper voice. It's in charge of your bone density. It's in charge of your arousal and sex drive. It's responsible for your erections. It's in charge of your, or it helps with your mood and energy levels. It plays a vast role in multiple body systems. So it is the main male hormone in the body and is critically important.
So what happens then if your testosterone is low?
So a low testosterone can cause a lot of problems, as you can imagine, with the long list of things that it does. Initially, once it gets low, you might first start noticing that you're just feeling tired all the time. You don't have that fatigue. You have fatigue. You don't have the energy to go about your day. You know, those honey-do lists that have been stacking up, and you just don't seem to have the motivation to tackle those one at a time. You might notice that your drive to have sex is less. You might notice that you start having more difficulty with erections. It's harder to keep and build that lean muscle mass, and it's a lot harder to get rid of that fat that keeps on piling up year to year. So it's critically important on the short term, and there are also some long-term components like bone density that we start worrying about if it gets too low over time.
So that can be more of a critical condition in the long run?
If it gets too low and stays too low, it certainly can be. Part of the treatments for prostate cancer is we have to take away testosterone completely. And men can have some very serious side effects long term. Luckily, most men don't have that serious of a low testosterone long term. But even the short term, those short-term side effects like fatigue, lack of motivation, lack of sex drive, they can certainly decrease your quality of life to the point where we definitely need to get that optimized.
Okay. So if I notice myself having any of these conditions, what can be done about my low testosterone?
Well, first you need to recognize that those may be symptoms of low testosterone, so you can start treating it. One of the things that we do as men is kind of put off and imagine that we're not having problems, and maybe if we ignore the problem, it'll just go away. But low testosterone generally won't go away unless you do something about it. So there are some things you can do at home and some lifestyle things that you can change to get your testosterone up. So there are three cardinal things. So one, diet; two, exercise or just movement; and three, good quality sleep. So the diet is important. So you want to be as close as you can to your ideal body weight. So avoiding too many calories throughout the day, avoiding foods that just aren't good for you. And I don't need to go into all those because everyone's already heard about that. But eating a diet with more vegetables, more plant-based fats can go a long way to make you healthier and to help you lose weight. The other thing that's been proven is that exercise can help increase testosterone, especially resistance training exercise. But cardiovascular exercise is very important. So a mix between cardiovascular exercise like running, skiing, biking, or kind of aerobic exercise to get your heart rate up and keeps it up, as well as resistance training like weightlifting or like activities that fatigue muscles very quickly is very important to help keep your testosterone high. And the third thing you can do, which is of critical importance, is to get good sleep. Your testosterone peaks in the morning because most of it is made during the night while you're sleeping. You need good quality sleep, at least 7 to 8 hours of uninterrupted sleep to make good testosterone. So anything that impairs your sleep with a difficult work schedule, stress, sleep apnea, which is a huge one, or waking up at night to urinate, can decrease the amount of testosterone that you make. So those are some things you can do at home before you ever step foot in the office to help improve your testosterone.
Okay. So does this testosterone, does that help with your mental health?
It can. So the studies aren't as clear in that. A lot of my patients feel like they have more focus and attention after we've kind of repleted their testosterone. But the long-term studies haven't really proven that is necessarily a case, but I've certainly had some anecdotal evidence that people have had improvements with testosterone replacement. Important to note, so if you've done all the lifestyle changes at home and you're still having problems, the next step would be to come in and we can assess that. So it's just a blood test that we do in the morning that can determine whether your testosterone is low and maybe the cause of some of these symptoms.